everyone. This is Erin Morgan with Insight Media. I am here today at Academy 25 in Boston, and I'm here at the 𝖬lisユ𝗂𝗋𝖾 booth to learn a little bit more about the revolutionary launch of the Stellus lens for myopia management. Thank you both for joining me, Dr. Ryan Parker, Dr. Monica Zhang. Could you each just share a little bit about what is your title, what do you do with 𝖬lisユR?
My name is Dr. Monica Zhang, and I'm the Head of Medical Affairs North America. So I'm responsible for the medical messaging and the translation of the science so that clinicians can understand the latest technology and bring it into practice.
Fantastic.
All right. And I'm Ryan Parker. I lead professional affairs for 𝖬lisユR. Monica's the really smart science one. I'm the product guy. So I get in the product details and then try to work with our accounts to make sure that product is implemented in the practice correctly.
Fantastic.
Yeah.
Well, we have very big news that has just recently come out. It received so much consumer media coverage. It was incredible, right? To see the public is very aware of this lens now. So I just want to ask you, and congratulations on the launch. And it is the first ever FDA market approved lens, spectacle lens, clinically proven to slow myopia progression in children. So how would you summarize the impact of this long-awaited FDA approval?
The impact is really going to be huge because in the US, there has only been really one other FDA-approved treatment. And then there have been a number of other treatments that clinicians can prescribe, but not necessarily approved specifically for myopia control. And all of these other options have been either contact lens-based or overnight lens reshaping of the eye or a drug-based treatment. So there were a lot of children that could be younger or they may not have been suitable to wear contact lenses or 𝗍𝗪𝗁. So this means that the millions of children that previously would miss out on myopia management now have an opportunity to be managed with something that is FDA market authorized with proven efficacy. So the study results on average over 2 years have demonstrated 71% slowing in myopia progression. So children wearing these lenses save 0.64 diopters over 2 years. And then the slowing is also seen in their axial length. And that's been shown to be 53% over 2 years. So there's good clinical data, robust. The study data has been completed and we're ready to help those millions of children access a treatment that's going to address the public health issue around myopia.
That's fantastic. So with this lens coming to market, and you answered some of this, what do you anticipate the impacts of the lens to be, even from the profession side of the profession of optometry?
Yeah, I think, so for years scientists and optometrists have been like, give me the data. What is it about myopia?
Yes.
What's different? And we've done a really good job. I mean, there's papers upon papers on papers that she knows all the answers to, for sure. And she gives me the cliff notes all the time, which is great. But I think we know now myopia is not a benign refractive condition. We should approach it differently. I think some of the barriers have been, it's tough. It's challenging in practice. So a lot of practitioners are waiting for an effective, simple solution. So I see this product as opening the doors in a lot of practices that have been going, I want to get into this, but it's too much of a heavy lift. So we're really excited that more children can get exposed to this revolutionary treatment.
Wonderful. It's tremendous. So I think that this is obviously a huge impact for the profession of optometry. And do you feel that the profession is ready for this kind of ramp up? And what will it take to get practices ready for, this is a big ramp up for myopia treatment?
Yeah, I mean, I think there's a couple subsets, obviously, and I know Monica works with a lot of practices. There's those practices that have been doing myopia management, and they've got it figured out.
Certainly. This
will be the easiest seamless integration. It's just another treatment in their toolbox. And then there's these practices that have kind of been sitting there for a while. And the good news is, at least the way I look at it, it doesn't change that much because it's a simple solution. And when I say simple, that's not the science. The science is amazing. But as far as fitting a spectacle lens, there's really nothing out of the ordinary that the practices aren't used to. So it does create a little bit of different conversation with the parents about why myopia needs to be thought of different and how this solution works.
Certainly.
But you put it in a frame, the kid wears it, and it works. What are your
Pretty
thoughts
simple.
on that? Yeah, pretty
Yeah,
simple.
I agree, because for a treatment to really be used, it has to be made simple. So it's easy to prescribe and it's easy to fit. And staff can be easily trained to fit these lenses in children. Now, other treatments need more of a learning curve, but I think everyone is aware that myopia matters now. They've just been waiting for an additional treatment in their toolbox.
Wonderful. So the big question is, the FDA approval was just received. When is the lens actually available for practices to order?
Yeah, and this is crazy. So FDA market authorization was September the 25th.
Wow, not too long ago.
And the teams have been working their tails off. I've never seen anything like this. So believe it or not, October 13th is when orders can be placed. October 20th is when the lens will start shipping.
Amazing. So
Yeah.
like next week.
It's like coming. I can't believe it. The time is finally here.
That's fantastic.
People are asking, why can't they get it today?
I bet.
That's the funniest
Right?
thing.
That one too.
Yeah.
So is there a website that our viewers can go to learn more about Stellis?
There is a website. They can go to essilorpro.com, and there's a landing page on there around Stellis to myopia management, and they can sign up to get more information. There's also going to be links to some of our learnings on Leonardo that are going to be great. We have a doctor-facing training. I'm going to do the optician-facing training. So lots of great training coming out.
Oh, that's great to hear.
And there's going to be a live webinar on October 21st for ODs nationwide, and the optician-facing webinar on October 23, because we know that the staff have to be on board to be able to make this public health treatment available to all children.
With the information and the training that they need. Yes.
And the good news is staff, I love my staff and my practice. We're not going to make it hard. There's a couple things to think about, but it's really simple. It's really simple, effective. I think they're going to embrace this, and they really get to make a difference in a child's life, and that's what we all do this for.
That's wonderful. Absolutely. What a wonderful thing. Well, congratulations. Thank you so much for joining us today. Appreciate your time.
Erin, thank you so much. It was a pleasure.
Thank you again.
Thank you. Thank you all for joining us, and we will see you again soon.